With the emergence of the Omicron variant, the CDC now strongly recommending that people 18 years and older get that COVID booster shot. Joining us today, Infectious Disease Specialist Dr. Joanne Passalacqua with Hartford Healthcare St. Vincent Medical Center to answer some of our questions. Hi, Doctor. First of all, thank you so much for your time today.
Well, thank you. Thank you for having me.
Well, with these COVID numbers going up, I think a lot of people are really wondering about this booster shot now. So in your opinion, what do you think about it? How effective is the booster?
I think the booster's critical. I hear a lot about panic and anxiety with this, and really I think that most importantly, this is a time for people to prepare. So the word is prepare, not panic. If you're not vaccinated yet, getting your vaccine, that's the most important weapon we have in our toolbox right now against this virus. And for those that are vaccinated, being boosted and getting that immunity back up to levels similar to immediately post-vaccination is very important as well.
Okay, and of course these numbers going up makes us wonder if there is waning immunity. Do you think that there is such a thing, that that's actually happening?
Oh, absolutely. I mean, the studies bear that out. We know that 6 to 8 months is the critical time frame post-vaccination where immunity begins to drop off and people's risk to become infected gradually increases. And so this is what boosting is directed at. For those who had the J&J vaccine, which provided about a 65% level of immunity post-vaccination. Those people have the opportunity to bring their levels of immunity up to 95%, very similar to the messenger RNA vaccines. And for folks who have had the Pfizer or the Moderna products, levels of immunity may wane down to about 80% at 6 to 8 months, but we can bring those levels right back up to 94, 95% with a booster dose. So this is critical.
Now, I remember when we were getting the first shots, it was like after your second and then 2 weeks, you're fully protected. What about the booster? So when you get the booster, when are you actually fully protected again?
This is the same concept. When you receive a boost dose, 10 to 14 days post your boost dose, you will reap the full effect of that boost dose. So, it's very important if people are making plans for the holiday time, Christmas or New Year's, now would be the time to be getting those boost doses so that when you gather together with family or when you make plans for air travel or train travel, you're well protected. You mustn't expect that a day or two after your boost dose that you're receiving the benefit of that dose yet.
Okay, well, we're hearing about the number of cases in Connecticut and, of course, nationwide going up. We're also hearing about this Omicron variant, and we're hearing about this waning immunity and talk of boosters. So who is it who's most getting infected right now? Can you talk to us a little bit about what you're seeing in the hospitals? Is it people who are completely unvaccinated? Is it that waning? Is this the variant? What is it that people need to know about these increasing statistics?
Yeah, so I've been caring for patients with COVID in the hospital since the very beginning of this pandemic. Over the summer, we were seeing people that were fully vaccinated breaking through with Delta, and that was very disturbing. But honestly, right now, the majority of our patients in the hospital with COVID are the unvaccinated. And, knowing that we've had vaccine available to the public for nearly a year now, it's very distressing to see these folks so sick. But the vast majority are unvaccinated people.
And there's been a lot of insight into which booster covers your immunity better than the other. Should we be overthinking this and mix and matching? Or what do you do? Talk to your doctor? How do you decide which one's best for you?
I mean, I think people should talk with their healthcare provider, absolutely. I think that if you received a particular product and you tolerated that product well, there's no reason to reinvent the wheel. If your body did well with something before, then by all means continue along with the same product. If you had difficulty maybe with a second dose of a particular product, then there's opportunity to change. Or if it's difficult to receive the product you received before, it's okay to change over. But I think if people have had something and tolerated it well, then stick with what you know.
All right, doctor, thank you so much for your time today. Really appreciate it. And where can people go to find out about making an appointment for a vaccine if they would like to do that?
Our hospital system certainly has vaccine available for the public. I know the MyChart Plus at Hartford Healthcare has vaccine available. Our local pharmacies also have vaccines available, and there are some clinics in the community as well. So I think your local hospital, your local pharmacy.
Doctor, thank you so much for your time today. Thank you. Really appreciate it.